A lot of women come in and complain about hair loss, and it's evolutionary on the rise, secondary to lifestyle, environmental changes, and different uses of hair care products as well. So let's go back to basics in terms of hair. When someone's complaining of hair loss or hair shedding, you normally come in and you say, "Dr. Vali, I don't understand. My hair is literally shedding on the floor." And the first question I say is, has something happened to you? Say 3 months ago or 2 months ago. Because if you've had a stressful episode in your life, your hair reacts 2 to 3 months later, and it goes through a phase called telogen effluvium, which is a shedding phase. And what we have to do is diagnose you correctly first. Or is there an environmental cause behind it, i.e. your hair weave or your extension are pulling too much and causing traction loss, or the headscarf is pulling and causing traction loss. So identifying the cause is one of the first things you should do. I ask my patient to come into the clinic and I ask them to pick up the hair from the shower, put it in an envelope and show it to me. And then we examine the bulb of the hair. And what we look for is whether the hair is actually in the shedding phase, which is telogen effluvium, or if it's in the anagen phase, which is the growth phase of the hair cycle. Because if it's in the telogen effluvium stage, the shedding phase, then your bulb will be straight. The tip at the top, right at the top, will be straight, the hair follicle. If it's in the anagen phase, then it'll be bulbous. My job is to identify this correctly, because once I've identified that it hasn't got to do with thyroid, it hasn't got to do with iron, it hasn't got to do with environmental hair extensions or traction pulling, but it's actually, or a stress event, but it's actually because you're in an extensive phase of shedding, I can then use a treatment to actually push your hair cycle or your hair follicles and trick them to go from the shedding phase back into the growth phase. And we do this by using your growth factors. We take your own blood and we use stem cells and we inject it right into the hair follicle to actually cause the hair follicle to move from the shedding phase into the growth phase. Because remember, when I'm directly injecting into your scalp, which sounds a little bit painful, but it's not too painful, you're getting about 90% bioavailability of that product directly into the cell, instead of taking these pills that actually you go and you urinate out and you don't know how much concentration is actually getting over here. So that's the first thing. The second thing is I always advise you the things you can do at home. So the first thing I say to you is stop using products in your hair. Stop completely. Wash your hair with baby shampoo twice a week only. What you've done is you've actually caused your own scalp, which again, like your skin, has its own protective barrier mechanism. You've caused it to become weak and lazy, because what you've done is you've added conditioner and shampoo and a few styling products right on top of it, which causes the cells in the scalp to stop working and produce natural hair oils. Because what you'll notice is once you stop putting foreign chemicals onto your scalp, your cells start working again and you start producing the natural oils and your hair calms down and it actually stops shedding. So that's the first thing I say. The next thing I turn around and say, try and go back to the basics. Your grandmother has beautiful long hair because she didn't use so many chemicals or products in her hair. She used natural oils once a month. So I say, try and use a coconut oil in your hair. And the third thing I turn around and say, take some vitamins such as biotin, flaxseed, B6, B12, all the B vitamins, all the good stuff to get the keratin back and get it a little bit stronger. Some people actually add on other things onto this, which they say do some scalp massages. But these are simple things that you can do yourself to actually identify and correct your hair loss problem and treat it before coming to someone like me.